There are two methods in which you can flush a feeding tube: the plunge method and the gravity method. Both will be demonstrated in this video. Ensure the patient is positioned comfortably at an angle of at least 30 to 45 degrees. Before and after handling the tube, wash your hands with liquid soap and water and dry them thoroughly. Apply gloves. You will need a 60 ml enteral feeding syringe and some water, the type and volume as advised by the managing healthcare professional. In order to administer a water flush using the plunge method, draw up the required volume of water into a 60 ml enteral feeding syringe. If present, ensure the feeding tube clamp is closed before removing the cap from the tube. If no clamp is present, ensure to kink the feeding tube between your fingers in order to stop leakage. Connect the syringe to the feeding tube, being careful not to over-tighten, and open the clamp or release the kink between your fingers. Slowly push on the syringe plunger to flush the tube with the required volume of water. Close the clamp from the feeding tube or kink your fingers before disconnecting the syringe. Repeat these steps until the advised volume of water is administered and ensure to close the feeding cap. Wash and store syringes as per manufacturer guidelines and ensure the patient remains in a position of at least 30 to 45 degrees for 1 hour post-tube flush in order to prevent aspiration. To administer a water flush using the gravity method, remove the plunger from the syringe barrel. If present, ensure the feeding tube clamp is closed before removing the cap from the tube. And if no clamp is present, ensure to kink the feeding tube between your fingers in order to stop leakage. Connect the syringe to the feeding tube, being careful not to over-tighten. Pour the required volume of water into the syringe barrel and open the feeding tube clamp or release your fingers. Allow the water to flush through the feeding tube via gravity and close the clamp or kink the tube between your fingers before air enters the tube. Repeat these steps until the total advised volume has been administered. Pour any remaining water in the syringe away and remove the syringe from the tube. Ensure to close the feeding cap. Wash and store syringes as per manufacturer's guidelines and ensure the patient remains in the position of at least 30 to 45 degrees for 1 hour post-tube flush in order to prevent aspiration. Always flush the feeding tube before and after the administration of any feed or medication. Ensure the whole length of the feeding tube is cleared to reduce the risk of blockages, and always follow the flushing regime recommended by your managing healthcare professional.